Hi, my name is Priyanka Sharma, and my presentation is on ovarian cancer and the associated laboratory testing for diagnosis. So, ovarian cancer is a group of diseases that involve the growth of abnormal cells into tumors in the ovaries. In addition, also the fallopian tubes or the peritoneum. The ovaries are a pair of female reproductive glands that produce eggs and hormones. And most people think that it's, just one whole cancer, but ovarian cancer actually includes several types, which includes types such as epithelial cancer, which is actually the most common type. This starts in the cells that cover the ovary. Germ cell cancer, which starts in the cells that actually produce eggs, and then fallopian tube cancer, which forms in the tissue lining of the actual fallopian tube. And there are quite a few others as well, but these are the three primary forms of ovarian cancer. So the symptoms of ovarian cancer can be really vague and nonspecific. And the problem with the symptoms of ovarian cancer is that they can be associated with any other common conditions. So as you can see, a lot of these signs are quite vague and arbitrary. And unfortunately, in the early stages, ovarian cancer often doesn't have any symptoms and has very few noticeable signs. And so some of these signs may present and it may not trigger the physician to think that it's ovarian cancer. Some of these symptoms can include bloating, fatigue, back pain, pelvic or abdominal pain, feeling full and bloated, having to use the restroom and pee more often, menstrual cycle changes, constipation or diarrhea, and even pain during sex. So ovarian cancer is basically staged based on how far the cancer has actually spread. It goes all the way from early up to advanced, and each stage is actually broken down into substages of A, B, and C. And so with stage 1, the cancer is just limited to one or both ovaries or the fallopian tube. Stage 2, the cancer has then spread to the uterus or other nearby organs. And stage 3, the cancer has spread to the lymph nodes or even the abdominal lining. And it can include nearby organs such as a diaphragm, intestines, or liver. And then once the cancer has progressed to stage 4, this means that it has spread to more distant organs such as the lungs or the liver. And usually with this stage, the cancer is often quickly recurring. And so staging of ovarian cancer is used to determine the prognosis and the treatment and the actual treatment plan for the patient. The treatment for ovarian cancer can include surgery and oftentimes chemotherapy. So one of the fascinating things about ovarian cancer is that it is difficult to diagnose, and there are laboratory testing that we use to identify ovarian cancer, but it's not exclusive to ovarian cancer. So there are markers that we use in the lab to confirm that the patient does have ovarian cancer, especially at the levels at which they result. But the difficult part is that these tumor markers are sometimes present in other conditions that are non-cancerous. So one of the laboratory tests that we use are CA-125. And so CA-125 levels are often high in people with ovarian cancer, especially with the more advanced cases. So the CA-25 test can help determine if treatment is working or if the cancer has returned. And the disadvantage of CA-125 is that it can be elevated in other cancers, which includes uterine, fallopian tube, pancreatic, breast, colorectal, lung, and stomach cancers. And even some in non-cancerous conditions, such as endometriosis, diverticulitis, fibroids, inflammatory bowel disease, liver disease, pregnancy, or even patients that have recently had surgery. And so it makes it really difficult to use it as a singular confirmatory test. And then the other tumor marker that we use is the HE4, which is the human epididymis protein 4. And this is a tumor marker that can actually help detect ovarian cancer and monitor the treatment response. So HE4 is actually overexpressed in ovarian cancer, and it can help distinguish it from benign conditions. HE4 is more sensitive than CA125 when it comes to detecting ovarian cancer. So it's often used in combination with CA25 to monitor the women that have actually been treated for ovarian cancer. And so HE4 can actually help detect if treatment has been effective or if the cancer's returned. And HE4 is actually measured using a variety of methods. And this can be with the ELISA, the enzyme-linked immunosorbent assay, the chemiluminescent microparticle immunoassay, even the bead-based array system, or the immunoradiometric assay and enzyme immunoassay. And so this slide just shows other proteins and markers that are sometimes used for the diagnosis and the confirmation of ovarian cancer. These are proteins and markers that can show up as being elevated, but again, none of these is singular in being able to identify that the patient has ovarian cancer and can be used as a singular confirmation tool. And lastly, I wanted to go over the genes for that have been determined to have somebody be predisposed to ovarian cancer. So the BRCA1 and BRCA2 are actually tumor suppressor genes that help prevent cancer by repairing DNA damage and controlling cell growth. So when a person has mutations in these genes, that can increase the risk of ovarian cancer. And patients that have the BRCA1 gene are more likely to cause ovarian mutations in the BRCA1 gene are more likely to cause ovarian cancer than patients that have mutations in the BRCA2 gene. So you can see it's quite significant, with BRCA patients being 50 to 65% more susceptible to getting ovarian cancer versus patients with mutation in the BRCA2 gene being at about 40 to 55% to get the disease. And so when we look at overall testing and even genetic testing for patients that could have ovarian cancer, there's this quote that stands out that says ovarian cancer is called a silent killer, but really it is a quiet killer in that it's really hard to detect. It's really hard to know if a patient has it because the symptoms are so vague, and you wouldn't know to get genetic testing unless you or a family member has had experience with ovarian cancer, and so you get confirmatory testing. And so it's really, really hard to diagnose. It is oftentimes diagnosed when it is already advanced, and so my hope is that in the future, as laboratory testing advances and that funding is obtained for more research, we're able to find treatments or at least earlier detection testing for patients so that they are able to have a more prolonged lifespan once this disease is detected. Thank you so much.